Statins are a type of drug that work by lowering levels of the LDL or bad cholesterol in your blood. By doing this, they've been shown in numerous previous randomised controlled trials to significantly reduce your risk of a cardiovascular disease event, such as a heart attack or a stroke of the kind where a blood vessel in your brain becomes blocked. Because of this, they're now used very widely, being prescribed to millions of people worldwide. It is known that statins can very rarely cause serious muscle problems. This is known as myopathy or rhabdomyolysis. What's been less certain, however, is whether statins more commonly cause milder muscle aches and pains. Because of this uncertainty, some people have not been willing to start a statin or have stopped taking them when they've already been prescribed them, when they might actually benefit from them. So we set about trying to address this issue. We gathered together all the information from the previous large-scale randomised controlled trials of statin therapy and merged them into a single database. This is known as doing a meta-analysis. It's a really powerful way of doing research because the fact that data is randomised means it's not subject to bias. It can include an awful lot of data and it allows you to look at effects in particular kinds of people. However, it took us quite a long time to do this because we received over 38 million records in over 840 datasets. However, we're now in a position to be able to share some results with you. We found that muscle symptoms are fairly common. They occurred in about a quarter of people whether they were taking statins or not. Statin therapy was found to marginally increase the frequency, but apparently not the severity of muscle symptoms, but these effects were largely confined to the first year of treatment. For people on statins who did develop muscle symptoms, over 90% of the time, this was not thought to be attributable to their statins. Our research tells us that people on statins may develop muscle symptoms, but that people not on statin therapy also develop such symptoms. For people on statins who do get muscle symptoms, most of the time statins won't be the cause. It should be remembered that the benefits of statin therapy in preventing heart attacks and strokes build the longer you take them. And so if you stop statin therapy, you may be putting yourself at risk of having a cardiovascular event, such as a heart attack or stroke. If you have concerns, you develop muscle symptoms, we would suggest you go and see your doctor and talk it through.